guys, good morning. So this morning, hopefully it'll work this time, we will be interviewing Dave, and his information on incorporating strength training into physical therapy. So make sure to join and ask your questions, and I'm going to bring him on, and you can learn a little bit more. I'll learn a little bit more. And good morning, Dave. How's it going?
Hey, how's it going?
Good.
Good, how are you?
Good to see you here.
Thanks for having me on.
Sure, I'm happy to. I'm just going to tell everyone a little bit about you, and then we'll get going with some questions, okay?
Great.
Dave is the owner of Inside Out Strength and Performance, and he's passionate about helping others get back to the activities that they love, which is a really great thing. And Dave specializes in addressing the underlying cause of pain and limitation through movement assessment and strength training to help individuals spend less time in pain and more time doing what they love, which hopefully we could all do. So if you've ever been in pain in your life and you felt stuck and not know what to do, then you can just comment below, because I think sometimes we've all been there at some point. So Dave, tell us a little bit more about what you specialize in or what your expertise is.
Yeah, and I can second that, Allison. I've definitely been there in the whole that whole pain thing, and it's not a fun place to be when it keeps you from doing what you love. But in terms of me, so I'm a physical therapist. I hesitate to call myself just a physical therapist. Performance-based physical therapist tends to be more of the title I use, because the people I'm working with, whether they think they're athletes or they don't, I think everyone could use to benefit from more of a little more strength, a little more mobility, just to be able to let them do what they love. And that's what a lot of it comes down to. Is with the PT I do, it's very movement based, very functional in terms of both the assessment and treatment of getting people moving and getting them stronger so that they can do whatever it is they need to do.
Yeah, exactly. And so you work on the preventative side, hoping to prevent injury with some CrossFit athletes, right? But then you're also helping to rehab injuries as well. Is that correct?
Yeah, so there's both sides of that, where some people come in just as more preventative stuff or interested in learning more about, say, a certain technique or certain movements, or they're looking to get into a certain workout, and can help people then from the preventive side of things to address any imbalances that they have, any mobility or strength limitations that could limit them at all in the activity that they're doing. So trying to set them up for success with that. But then also the people that are already experiencing pain or injury, and a lot of times most people that I work with, it's more overuse type stuff, of not necessarily something acute that just happened yesterday, but something that has been ongoing, and they don't exactly know how it started. And those are the people that I tend to work a lot with in terms of CrossFit and runners and bikers, anyone that's active and has living an active lifestyle, and just feeling the effects of that over time is the other side of the population that I tend to work with.
Right. Yeah. And that brings us more to the wellness component too. And Dave and I have had this conversation before, that sometimes I think physical therapists, we need to change our model a little bit. And just like how we go to see the dentist every 6 months or so to have a checkup and make sure that, there's no issues with our teeth or our gums, really as just being human beings and doing all that we do or don't do if we have a sedentary lifestyle, that checking in with a physical therapist or some type of healthcare practitioner every few months to make sure that our posture is okay, or how we're moving, or the activities that we choose to do if we are on a bike for several hours a week, that it fits us correctly, that sort of thing can really help to prevent injury. Or if you have an injury, then it can help to heal a lot quicker. So Dave, tell me, what does wellness mean to you?
Yeah, for me, wellness it comes down to a pretty simple thing of allowing you to do anything that you want to do in your daily life. And that's, for some people, that could be CrossFitting 6 times a week. And for some people, that's playing with their kids and being able to get
Get on
up and
the
down off the
floor.
ground and or
Yeah.
be able to go on a hike or a long walk or go to the beach, so all those things, everyone's lives and what the things they enjoy are different. Some people that's an extreme level activity, and some people that's just your day-to-day activities. But to be in that category of wellness, it's being able to do anything you can without pain and without limitation. And that's going to look different from person to person, but everyone should be able to do whatever it is that they want to without feeling like they're worried or they're anxious about hurting something or not.
Yeah.
Yeah, absolutely.
Exactly.
So that's a huge part of wellness for me, and that's going to look different from person to person. That's where it's highly individualized, but you should be able to do those activities that you love.
Yeah, exactly. So if you're watching, just comment below if you feel that you're limited in something or have a wish or a dream that you'd like to be able to do something, but you feel limited by pain or maybe just fear of movement. Or, I've talked to people that they're hesitant to start an activity like yoga or strength training because they're afraid to get injured. Then comment below and we can work as a community to help each other out. So Dave, what most frequently is the biggest tip you tell your clients and patients if they are very active, that they can the biggest way that they can incorporate wellness into their lives so they can stay pain-free and do what they want to do?
For me and the patients and clients that I work with, I can consider myself more of a teacher than a therapist at times, as so trying to empower them to be able to handle whatever it is that they're dealing with on their own. So trying to create independence. I tell people when they come to see me, they're not here to be seeing me for every week for the rest of their lives or anything. That's absurd, and people should be able to correct things on their own, and they should be able to deal with things on their own. So whatever the activity that they're doing, or just daily life tips of getting people to think not just about the what, but kind of the how and the why behind it, of allowing them to troubleshoot through things. And if they feel something that feels a little off when they were jumping on the bike, then giving them some tools to be able to think through that a little bit, try some of the things that they've learned, and a lot of times that clears things up. And if those things continue to be ongoing, that's more when I would come in to intervene. But for most people, I think most people should be able to be independent with their wellness, with their activities.
Yeah, exactly. So you're promoting independence. I always compare it to teaching you guys how to fish, so that way you can go off on your own and get as much fish as you want, versus me just handing you the fish, and then you're always dependent upon me. I believe the same. So awesome. And how do you work wellness into your business model, into your practice?
Yes, we kind of touched on it earlier. So there's a decent split between people that are already in pain and people that are just looking to be more preventive. So the primary way that wellness comes in is if someone's just seeking that to begin with, but even those that are in pain and then getting them out of pain and back to the activities they love, there's still that occasional maintenance, and that's going to vary from person to person. Like you mentioned with seeing the dentist, you see the dentist two times a year to make sure everything's all good there. And same thing should happen for some people. That's just a once a year check-in of hey, I want to see how I'm doing, make sure I haven't created any other imbalances or any other limitations, so that, because a lot of things are preventable in some senses, of if there's some glaring mobility or strength limitations, that's hard to see on your own. Even as therapists, I think I could speak for probably both of us, at least for myself, of I can't always tell what's going on with my own movement. I have maybe more awareness than the average population does, but at the same time, I see coaches, I see therapists, and health practitioners too.
I go to my people.
Yeah, because every good coach even should have a coach, because there's biases we have, and we can't see things on our own. So that model of either once a year for some people it's twice a year, and some people are coming every month to just for a tune up and just to kind of adjust the exercises and the movements they're doing, and people that are being proactive in their health.
Right. I love this because it's outside the traditional model of physical therapy where someone has pain and then they come and, you know, they wait for their insurance to get authorization, and then they only come the amount of times that their insurance covers, and then they're done and we never hear from them again. This type of model is more proactive. They're literally investing their time as well as their finances, but because they're more responsible and committed, and it's a longer investment with you, then they're typically seeing better results. That's what I see in my own practice.
Absolutely. And along with that real quick, Allison, too, that it seems like a short-term time and financial investment, but you're saving yourself a lot of time. The people that are avoiding the injury, so say you're coming in once a month for some preventative stuff, and that allows you to participate in yoga or CrossFit over the course of the year without having to miss time,
right?
As opposed to the person who waits for something to break down, and then all of a sudden there's this big chunk of financial investment and they have to go be seen for 10 or 12 visits at a time at a therapy place, instead of doing that, the steps along the way to help avoid that in the first place saves I think time and money and frustration in the long run.
Yeah, exactly. And plus, it's less time. Like if, you know, someone's waiting to the warning bells are like screaming that, you know, there's some kind of injury going on and inflammation, and they wait so long, then they're ended up having to take off a lot of time from the activity that they love. Whereas if they kind of nipped it in the butt, or even were more on the preventative side, they might have been able to practice the whole time through too. So it's less time, it's more time being able to do the things that we love in the end.
Mm-hmm.
But it's hard because sometimes you don't see that immediate feedback. And I think sometimes with our society, we look for that instant gratification, where if you are more on the preventative side, how do you know it works? You just have to trust the process sometimes and believe in it. Mm-hmm. So as an entrepreneur and business owner, what's the biggest challenge you've had to overcome?
For me, the biggest challenge is just how to get out in front of people, how to, as a business owner, they don't teach that in PT school. We're really good about teaching the skills you need to treat people and to see different diagnoses and the treatment to do. But in terms of that's such a small percentage of what we actually do as business owners. And like you said, incorporating wellness in, and how to get out and get in front of people to share your message and get people to buy into health and to wellness and to the therapy is difficult. They don't teach any of that. And I think we had one business class in PT school, and I don't know if I got anything from it exactly. Yeah. It's not super applicable. So all those things are, and that's what makes it fun though, in terms of learning different ways to get out and to be able to meet people like you, Allison, and a lot of the other great people have gotten to meet throughout it is super cool when you're not stuck within just clinic doors, seeing 20 patients a day. The different model allows you to just expand in the community and with other people who are trying to do the same thing and raise the quality of therapy and of the healthcare system.
Right, exactly. So if you're watching this now or you're watching this on replay, comment below if you're a PT or an entrepreneur and you're looking to connect with like-minded individuals, because we're all here, and the more that we share ideas, it sparks other ideas, and we raise the PT profession as a whole. So definitely join in with your insights. We'd love to hear you. Good. And how do you incorporate wellness into your own life?
So for me, I try and stay on top of it. I can be a little stubborn, and I probably wouldn't be the best patient from a physical therapy standpoint, as we all tend to be. But yeah, I'm very, very regimented throughout my week of making sure that for me, getting a balance of I really enjoy working out and strength training, so that's a big part of the fitness side of things. But I think overall wellness and training encompasses so much more than just the fitness part. So for a lot of people, the fitness side of it is easy. If people can go for a run or jump on a bike or jump into a CrossFit workout without thinking twice about it. But the real wellness stuff comes in all the other stuff that I'm doing outside of it too. Of, are you recovering? Are you doing your mobility work? Are you just getting general movement throughout the day and going for a walk and getting outside in the sun and eating right and managing stress? So all those things are,
Right.
although much easier said than done, it takes a lot of investment to manage all those areas, but knowing that it's super important for long-term just health and happiness. And but don't think that you have to do all those things at one time either. There's little ways to start to incorporate things in your life. Of, if you have the fitness part down, starting out by spending 5 to 10 minutes in the morning doing some mobility work or going for a walk is an easy starting point to start to layer some of those things into your daily life and make them more into habits. And as you do that week in and week out and month in and month out, then you become more well-rounded, and that'll help a lot with long-term health and happiness. And those are all good things.
Yeah, I totally agree. So yeah, just to summarize, like starting small, because wellness is so much more than, like Dave said, jumping on a bike and just getting our heart rate going. You know, you have to take in all these other different facets of your life, which sometimes can be overwhelming when looked at just trying to do it all at the same time. But if you just start small and slowly start to implement ideas and practices into your daily routine, and then even 5-10 minutes a day, that's what I find has the most impact, of doing that short amount of time, but every day or most days, then you start to see results for sure. So yeah, super important. Great. And Dave, do you have any parting words of wisdom for us here?
Wisdom. I guess I think people wait until they think there's this magical time when they're all of a sudden be ready to seek help or to seek treatment or to get started on their goals, when there's a skewed perception, I think, especially with social media, of looking at, even you look at healthcare practitioners like us, who maybe it seems like we have our wellness together, but I bet you we can spend a whole multiple hours on all the things that we're working on and all the struggles we have. And to just come as you are with that, and know that there's not going to be that magic time when all of a sudden you'll be ready. And it's taking small steps, and whether that's on your own or if you need more guidance, there's plenty of resources and people available that we're here to help in terms of getting you started in that wellness journey. So for me, it's telling people to not wait, because it's not going to get any easier the longer you wait. And it's not going to be this one time where you're all of a sudden going to wake up one day and feel like you're super ready. There's a lot of things that go into it.
There's going to be a sign that says, do it today.
Yeah, exactly. And it's a hard journey to do on your own. I for me and for you, I'm sure there's a lot of people I consult and go see, and I like to have a team with me on that, because it's a lonely journey if you're doing it on your own, and having a good support system around you is huge.
Yeah, totally. I agree. Yeah. So guys, take action now. Sooner is better than later. And don't wait for that perfect moment, because if you're always waiting, that moment's very elusive. It's just going to keep stretching out to the future. So again, if you're looking for other people to connect with to boost your wellness, if you're looking for healthcare professionals, then just comment below. We'll hook you up. That's what we're here for. So Dave, thank you so much. Tell us how we can get in contact with you, and where can we find you?
Yeah, so IO Strength Performance is on Facebook, on Instagram. Post some videos on a YouTube channel as well to try and be more of an educator with it in terms of giving people the tools to help do that. So that's the easiest place to find me and follow me. If you guys are watching this on replay, I know this can be a hard time for people to make that are in the regular workday schedules, but comment below, tag me in a comment if you have any specific questions, or find me on any of those pages, and just shoot a message. Feel free to say hi and bounce any questions off. For anyone that's considering or not sure where to start, I always offer a free 15-minute phone consult too for anyone that's interested in just seeing like, hey, I don't even know where to start. Who should I be seeing?
Yeah.
Where should I be going? And sometimes that's with me, and sometimes that's sending people to a different route. But if anyone's interested in that, that's a no pressure thing to get on the phone just to hear more about what's going on and what's the appropriate next step.
Awesome. So Dave, when we get off this call, will you add your website and maybe Instagram in the comments below so they can find it easily?
Yeah.
Okay, cool. And
absolutely.
Yeah.
Thanks.
Huh?
I was saying thanks so much for having me on today, Allison. It's always good catching up.
Yeah, for sure. And I highly recommend jumping over to his YouTube channel or his Instagram channel. He has a ton of awesome videos and a lot of insights. So go check it out. All right, guys. Thank you so much, Dave, for coming on. It was awesome.
Yeah, thanks, Allison. Talk soon.
Okay, bye.